Now it's time for the roundtable, the final roundtable before the conclusion with Emmanuel Soubeyran at the end of this morning and the lunch break. So the roundtable is now about to start with, so you, Teshome, you stay with us, Mebatsion, and also Thierry Lefrançois, you just heard before your presentation. And we'll add into this roundtable Pascal Hendrikx, who's responsible for the PRISM platform, ENSV FVI, and Orla Shortall, who's member of the Social, Economic, and Geographical Sciences Group at James Hutton Institute. I will not say more because this roundtable will be moderated by two very interesting and a lot of knowledge about the topics moderators. First, Thibaud Porphyre. I remind that you're a quantitative epidemiologist at VetAgro and researcher at the University Claude Bernard Lyon 1, and you lead the IDEX Line Industrial Chair in Veterinary Public Health as part of the BPH hub. And also, you will work together with Xavier Bailey. You're a molecular epidemiologist. You manage a research unit which works on the epidemiology of animal and zoonotic diseases and includes members of the French National Institute for Agriculture, Food and the Environment, and also VetAgro. So I give you the floor now for the roundtable.
Thanks a lot, Fabrice. So in this roundtable, we are willing to talk about how to improve the detection and control of infectious disease stress. And as we already made during all this session, we will discuss further challenges that arise when infectious diseases can cause species barrier among wild, domestic animals and humans, and leading to the necessity to detect and control them before they generate really far-reaching health and economic consequences. And thus, during this time, we will probably talk about different questions, what can be done to ensure effective and timely intervention. We can perhaps try to have different private and public stakeholders engaging together, taking into account their specific objectives, harmonize their procedure, or improve communication between the different partners. And we will probably finally question the role that the general public can play in improving surveillance system and ensuring that diseases are properly mitigated. And so, as Fabrice said, to address these questions, we are welcoming back Thierry Lefrançois and Teshome Mebatsion, and as well as Orla Shortall and Pascal Hendrikx. So to complete what Fabrice said, Orla is an interdisciplinary social scientist conducting research on governance and decision-making in agriculture, with a particular emphasis on animal health issues. And she is working in the James Hutton Institute at Aberdeen, but also more broadly in the Center of Expertise of Animal Disease and Outbreak Consortium, called EPIC. And we will also have with us Pascal Hendrikx, who is a veterinarian and a veterinary inspector, an epidemiologist specialized in surveillance. And among others, he headed the epidemiology and surveillance at the French Agency for Food, Environmental and Occupational Health and Safety. And during the last years, he has been particularly involved in training, a particularly important aspect, as Thierry said previously, training on global health issues through the coordination of a training platform called PRISM. So,
okay. Yeah, thank you very much, Xavier. Just for clarification within the panel, Orla, Pascal, can I have few words on how your research contributes to surveillance control of infectious disease, just quickly for introducing your research to the audience. Orla?
Thanks for that, Thibaud. So my research looks at partly at farmer decision making. So, for instance, the bovine viral diarrhea eradication schemes in the UK and Ireland. So that was a public-private partnership to eradicate disease within cattle. So how did farmers respond to that eradication program? How do they implement it on their farms? So looking at kind of the cultural factors in agriculture decision making, more systematic factors, so how biosecurity fits with all the other aspects of on-farm life. Also looking at wider systematic issues, markets, policies, how they influence change within agriculture, and the conflicts of biosecurity and other aspects of the demands placed on agricultural change.
Thank you very much. And Pascal, what about your research?
Yes, so hello to everybody. So I just wanted to say that I'm not anymore at the CIRAD, but so I'm changing a lot. But now I'm at the High Council for Food and Rural Affairs at the Ministry of Agriculture. But it doesn't change anything about my topics and my research, and I've been very much involved in the development of assessment evaluation tools for epidemiological surveillance system, and I've been very much involved in the organization of surveillance systems, and because I think it's a very important part, because we have a lot of tools for surveillance, but we are usually lacking of appropriate organization to make the system work appropriately.
Great. So we know already that detecting emerging pathogen as early as possible is critical to be able to act efficiently upon the risk. Several of our presentations highlighted that fact really well and clearly using African swine fever or COVID-19. However, how should we proceed in the One Earth context with meeting the needs of different stakeholders? Thierry, is animal a good, for example, a good target for surveillance to prepare human spread?
Difficult question. Animal is one of the targets, I would say, obviously. And if you are talking about wildlife, I think it's important, first of all, not to put all the risk, not to make a caricature of the risk, and not to put all the risk on one kind of animals or one kind of anthropologic risk. So wildlife is one, and especially live markets can be one way for introducing the virus in a human environment. But it has to be think globally and not consider to, because if you make a focus only on one species or one kind of species, it can lead to decisions that could be extreme, like preventing any wildlife or hunting, even in the southern country, which is not possible considering the resource limited in the country and the way of life. So wildlife, yes, but not only. And considering wildlife, the difficulty is to do an efficient surveillance. For example, as Marion has shown, all the viruses that we know, and especially the coronavirus, are circulating mainly in bats. So surveying bats is a good thing, and it's a good thing to understand the evolution of the virus within the bat component. But again, it's not enough, because you will not be able to assess all the bats and all the virus present in the bat within the different places of the world. So intermediate hosts should be also being under surveillance. So, and to do this kind of surveillance of wildlife, you have to implement innovative tools, new technology, and you have to be able to detect the first clinical cases, and you have to do also non-specific surveillance. So it needs a lot of collaboration between microbiologists and between ecologists to do so.
So I jump on what you're just saying, is that there's a few questions in the chat during a presentation of Marion Koopman, for example. And they were asking if, less in terms of surveillance, but more in terms of control for vaccination, should we vaccinate domestic animals against SARS-2 virus, is there an efficacy space to vaccinate them, and is it a way to control disease in humans? Should we also think, and that can be answered by Teshome, should we think about an interest market of SARS-CoV for animal species or other disease, other animals like ferrets, cats, others, and should we organize a platform that is both for animals and humans? Is there a commonality there?
I mean, I can start at least from the animal health point of view. Now, as you know, this is a disease that, at least in my view, that transmit from humans to animals rather than vice versa. I mean, cats get from humans, and the dogs are getting the disease from humans. Although there is also in mink, the disease can transmit from animals to animals. Now, for us, is another factor is really our customers or the animal owners. They should be willing to buy a vaccine, even if we prepare. So, I mean, we can make a vaccine against COVID to be used in dogs or cats, but unless the owners use that, there is no use. So at this time, we do not see. I mean, we have vaccines, let's say, already prepared. It's not, licensed. We have candidate vaccines. But we are, let's say, will be waiting if, in case of an animal-to-animal transmission. That would be where we see that, receptive customer to buy the vaccine and use it. Until that, it is more preparation, wait, and see at least from the animal health point of
view. So, Xavier?
Perhaps regarding this question in the chat, there is a question regarding the way the detection of emerging diseases can be performed in the different countries of the world, saying that it needs mobilization of resources and knowledge of professionals, in illustrating that, saying that an emerging disease somewhere may last more than 1 year without being detected due to the lack of the latest laboratory technologies and data exchange and reference laboratories. So to which extent this reflection actually impact your point of view of this One Health issue?
If I may, on this topic, I would like to go back to what Thierry said about the possibility to develop non-specific surveillance systems, and for example, developing a syndromic surveillance system. And Marion Koopmans told about a data intelligence hub. So it's always a dream to have a data center where we gather all the data, but I think a lot of data are existing and are possibly accessible more if you have a public-private partnership. And I think it would be very, very interesting to put more effort in being able to monitor all these sets of data and being able to make them talk together and make them accessible to a group of people who are in a position in case of emergence or before emergence to have a risk assessment and an appropriate data analysis. And so I think at this stage it's quite interesting and important. And just to finish, I think it is also the opportunity to broaden the scope of the surveillance, because we are very much talking about infectious disease surveillance, but again, Thierry spoke about the health of territory, and WHO is pointing out the fact that nearly 1/4 of that in the world are linked to environmental issues. So I think it's quite important to broaden also to other aspects of environmental health, and it's also linked with infectious disease, because with COVID-19 we know that the social situation and other disease are an important issue for the impact of the disease. So I think it's quite important with these syndromic surveillance and data-driven surveillance to broaden the scope from infectious disease to also environmental disease.
So you're talking about the stakeholders and these private-public partnership. And so do you think that what we need to change is this relationship between stakeholders and how they interact and communicate between each other? Do we need to improve that, or is there any, do we need to remove silos, understanding what, but to break the silo, we need to better understand what matters for each stakeholders. Is there a forum for each other understand what their needs and understand the difference between what matters for the research, for example, or what's important for implementing surveillance or for the industry?
I'm completely convinced that prevision is quite difficult in emerging disease. We are always surprised, and the thing we can do is to make sure that appropriate people are gathered in case of a problem, and appropriate people are coming from private and public. I usually say that the surveillance system is a way to make working together people who are not used to work together, and I think this is one important challenge.
And Orla, you wanted to add on that?
Yeah, just to reiterate that in the UK, there's data collected for different purposes that isn't used for a common goal. So I think public-private, so a certain amount of animal health is developing in a public-private way within certain countries, including the UK, but they have, to a certain extent, different goals. So a lot of data collected in the UK will be by private actors like retailers, other actors in the food supply chain, and that's for verification with their own standards and for proving health and welfare aspects to consumers, rather than trying to meet a goal of public health and contributing to an overall national surveillance. So I think part of that is thinking about how those different pockets of data and types of data could work together. And so there is obviously instances of that working where farmers will send in samples to check for endemic disease on their farm, and they don't think of that as contributing to a national disease surveillance goal, but it does contribute to that goal through passive surveillance. But I think often they're not aware of that broader goal as well. So there are systems in place where actors do work together without sort of knowing it. And if, there's suggestions that if farmers knew that sending in laboratory samples contributed to a national surveillance goal, they might be more willing to do that, or it might incentivize targeting samples from certain animals, certain regions. So I think, it definitely, in a lot of countries, animal health is moving away from sort of government command and control towards public-private, but there's a lot of coordination still to be done, it seems like, in different areas.
Yes, and you're talking about a lot on data, for example, and do you think that more is merrier? We need more data for supporting surveillance or as well as control activities, especially in a time where we're all talking about AI, artificial intelligence, and is more data always a good thing? Thierry, I think, do you have any thought on that?
I think in the continuity of what Pascal was saying, we need to broaden the kind of data that we want to collect and to put under surveillance. When I'm talking about broadening, it's not only different factors that we know to lead to the emergence of disease, but also for early detection we could reinforce the role of unofficial information. And I'm talking about trying to work on text mining, web scraping, web scrolling, whatever techniques exist, and artificial intelligence that can help to early detect abnormal events. So that could emerge in one place. Let's say abnormal fever on pigs in one specific place. So that is a kind of work which is done currently at a research level, especially in the European Mood project. But what is important is that it's developing in collaboration between researcher and decision makers. It's a collaboration between research institution and surveillance institution like WHO or ECDC. And we have to work on that and to, I would say, multiply the kind of data that we put under survey. Not necessarily multiply the number of data in each type, but broaden the type of data.
I say just one word on this. I'm not going to say the amount of data or what the role of AI would be, but just gaining 6 months, gaining 2 months before an outbreak is a huge, would have a huge impact. So the effect of, do whatever, let's say that is, Thibaud, for instance, an area of expertise for you, whatever data, whatever you put together, AI and everything, but tell me like 2 months ahead of time before an impactful outbreak comes. Give me, a heads up 6 months, it would be huge. So what we need is whatever time earlier notification we get is help us in really saving huge amount of animal life and the whole impact.
And this is why both systems have to work together. So it means we have not to replace classic surveillance by data-driven surveillance. It's very important to maintain and to further develop, because in many parts of the world they are not enough developed. The classical surveillance systems with people in the field who are able to detect clinical signs, who are able to detect abnormal things. But the data have to come in complement to add and also to more objectively assess the situation. And so both have to be developed and work together.
I would add, if you want to gain 1 month or 2 months, you also need to work on trust between the different stakeholders involved in the surveillance, between the scientist and the decision maker, between the public and private. And to build this trust, you need to work on the long term together on surveillance system, and not only be reactive when there is an emergency, but build on existing crisis to build a long-term collaboration.
Yeah, Andre. Yeah.
Yeah, and I'd add to that. Oh, sorry. Yeah, and the point of trust. I think that's really important, and it's and there's research that that trust isn't just about. People don't think of it in a narrow sort of goal direct, siloed sort of way. So farmers will think about their interactions with, say, the government in general, and how interactions and other aspects that aren't to do with surveillance or even animal health influence their feelings about that organization and their likelihood to want to, to want to contribute to goals, to surveillance goals, to public health goals. So I think the quality of relationships or social capital in general is really important, and it's out with sort of individual goals and individual sort of functions of different organizations.
Perhaps just having a look at the chat and talking about trust, there is a point in the chat about the impact of protocols, international protocols, as the Nagoya Protocol, and how finally the interaction perhaps between trust, economic problems could impact the way we tackle health problems, and how we can deal with all these different aspects.
What shall I say? Nagoya. I mean, it's an important subject. It's an important subject with well-meant, objective of, sharing any gain that is made from a genetic resource that's coming from different parts of the world. But I think it has also some, unwanted side effects, and then that unwanted side effect is based on really the lack of trust. And even I think even getting some isolates for diagnostic, for analysis, for research purpose, became much more difficult. Because even before, in order to share the gain, one has to make vaccine and then sell that. So, and then I think private companies are willing to do that. But unfortunately, we have to work, I think, in building the trust between the countries at times where this genetic resources are coming from, and the countries that use the data, the genetic resources to do the research and to make the vaccines. And I think we see challenges, even doing research become challenging. And I don't know whether others have some opinion how to address that, but it is an area where some improvement needs to be done. Particularly, we have to work in building the trust so that at least research will not be blocked by the Nagoya Protocol.
As you talk about the trust between scientists and policymakers and maybe industry stakeholders with the policymakers. So, how do you think we can improve that trust? Is there a way to share information, better prepare, talk to each other? But is there a way to improve scientific culture from policymakers, for example, because if they understand what we're trying to do, and I think that the Nagoya, that trust is more like there's an idea of working together, but there is also another a problematic of not understanding the value of each other.
Mm-hmm. Mm-hmm.
So can you develop on that?
I think the One Health approach is useful for bringing different perspectives and different disciplines into conversation with each other. And I think that can be helpful for promoting trust. So I think a lack of trust might come about if people perceive certain experts or certain groups as having a very narrow set of objectives or goals or thought processes. So for instance, there was really interesting and useful discussion earlier about the intersection between human health, environmental health, animal health. And I think if there's a recognition that all of those are important together and that all of those are being considered together within decision making, I think that could help foster trust. So for instance, if we think about, if we thought quite narrowly in terms of animal health, say, and we thought, what would the perfect farm look like for detecting and controlling disease? It might be something very, very controlled, something that in some sense resembles a factory maybe. But if you produce a farming system or an agricultural system like that, that's just designed solely for certain biosecurity goals, that could have detrimental knock-on effects on the environment, on social aspects of farming. So I think the idea of bringing that we're widening our questions and we're widening our decision making and having these conversations, I think that sort of, and being exposed to different perspectives from different disciplines and domains, I think it takes longer and it's more, it's quite difficult in lots of ways. But I think that could help foster trust.
I've seen a question from the chat also. There's from that about African swine fever. Again, it's a virus. We there's someone also in the chat highlighting that we're always talking about virus and everything, but I think it's relevant for other pathogens like parasite and bacteria. But they say that in that question is there's a feeling that we got close to a global pandemic with African swine fever, but the R&D only, stopped when it was affecting only Africa, the research and the R&D wasn't that well developed, but as soon as it was affecting Europe, the R&D speed up massively, maybe also in China and with the risk in the US. So I think there's an issue in terms of global aspect, but also does that affect the trust that, in particular in terms of the public perception, given the place of some of the livestock, we're talking about some of the animals, whether it's pets or livestock, to the general public. How can we relate that lack of interest in developing a tool with the distrust?
We usually say that trust is built on the past and not on the future. So, of course, if you have many examples that not giving trust to the public, it's difficult to say that we are going to improve the system. But when you say that now we have research finding treatments or vaccines for paludism, for example, so it gives trust for the future on these topics. I don't know if I'm on the subject, but I just wanted to go back to what Orla said before, and because I fully agree on the need to have a shared decision making which is very important for trust. And if you put all the stakeholders around the table and ensure that they are in the position to take part of the decisions, this is a very important step in the trust. I think this afternoon we'll have a presentation about the French platform for epidemiological surveillance, and it was an important achievement in the governance of surveillance in France, to put all the stakeholders around the same table. And just to finish on trust, so on my side, so institutional organization is very important, and the second important thing is the training, because if decision makers are trained and are aware about what are the constraints and all the different aspects around emerging or environmental disease, it's an important step for them to trust the scientists and all the different stakeholders, and the importance to give them access to the decision also.
Perhaps about yeah, for sure.
Go on, Xavier.
It was a question for you, Thierry. Actually, I had a question about the fact that we were talking about the trust, perhaps at a global level, and I think that, for instance, the management of the COVID-19 crisis and is a particularly interesting issue, because there was a lot of decisions that were taken even at the national level. For instance, in France, with the panel, or thanks to the panel that you're contributing in. And I was wondering whether you were thinking about how actually a more global thinking about the solution of the way to behave would have improved the way we manage the crisis, and which are the lessons that we can get from that?
Yes, definitely. Within the panel, we are thinking about currently about the future, and some kind of recommendation in terms of what should be the panel or a panel for a future crisis. And obviously, one of the key words would be have at least a multi-countries or regional approach or worldwide approach, and sharing information. So we are sharing information between, for example, European country or even with South Africa, whatever. But working together at a regional level should be much more efficient. That's for sure. I wanted to also to go back to the question of trust and the Nagoya Protocol. It's important not to make a caricature of the Nagoya Protocol. This is a protocol which has some benefits, and especially the benefit for countries which are producing either data or samples and whatever. So the same way we build trust, we need to understand the objective and the benefit of the other party. The Nagoya Protocol has some benefits, and people who are pushing for the Nagoya Protocol have to understand that sharing the data, sharing the sequences has also some benefit for the development of vaccine, for example. And to do so, there are some techniques, now the theory of change, for example, it's a technique to understand or to build together an overall common objective while you are understanding the objective of each of the party and building activities to be developed by each of the party to better tackle a specific problem. So it could be that kind of techniques which could be developed at a regional level, for example, to share a common objective and activity that can be developed by each of us.
Okay. There's another, some comments in the chat that are very important also regarding the Nagoya Protocol is that, for example, it has been pointed out that it's more ethics than and more than that is more than trust. So it's the Nagoya is there to bring some guidelines to ensure that researchers and scientists, do not, are ethical in some ways. So basically, there's a treatment between accounting for the fear for losing the prerogative and resource from individual organizations that are local, for example, in Asia or in Africa, and to ensure that they still have ownership. And that is, it goes with very much with the fact that another, the ethical aspect, and that scientists need to be ethical, should be ethical when they do research. Do you have any comments on that? I do believe that that comment is actually core to the idea of trust. Orla, do you have any thoughts on that? Or Teshome, go for it.
Yeah, just to give some concrete examples. Since for the Nagoya Protocol, we work with different countries, as a source of genetic resources, and there are countries where we have really good working relationship, and then that's also really a factor where the data sharing, the strain sharing actually works on trust basis, and that we don't have much problem. But there are also some regions or countries that also just we have to continue to work on that we didn't have such established working relationship where it is challenging even to do research, even to to get some whether it's a strain for diagnostic or vaccine research becomes a challenge, and times there are negotiations that is taking more than a year, and then at one point you say, okay, good, just I'll give up. So that is, I think, I don't know whether sort of education might help how both parties can benefit from this shared resources. I think it's also our duty to clearly show the the benefit, the objective, and the data sharing or an outcome from that specific genetic resource. But still, it is a work in progress.
Another part of this issue, there is also the fact that some places in the world have some difficulties to implement proper health surveillance systems. There is a question in the chat about the places where emerging disease cannot be detected without surveillance system, and how we can improve that. There is perhaps a piece of answer with what we discussed with using really different kind of data, because there might be perhaps different indicators that could help with that really targeted surveillance to detect potential emergence. Don't know whether it's an interesting way to handle the issue, or whether you're thinking about other way to handle that.
If I may, I would like first to say that the current crisis demonstrates the fact that emergence is a worldwide issue, and so the world should help developing surveillance systems everywhere. It's our responsibility. So I agree that it's good to share, but it's good to share in both ways. So share the capabilities and share the data information. So that I think that it's a question of, again, ethics and equity, and we have to work on that, definitely.
Who should help for development? Who should help for implementation? Which actors should be implied in that? Working on these different issues, that's what you mean?
No, I think we have really some good working examples. Look, when you see from a disease point of view, I mean, particularly for the ones that we already know, I mean, African swine fever is a good example. BTV is another example. If we ignore it, saying that, okay, it is somewhere in Africa, it strikes back. It hits at one point. So the best thing is proactively collaborate and work toward the problem. I mean, let's take BTV. We know there are different serotypes. They are moving, North Africa, moving towards South Europe. If we simply wait until they come to Italy or somewhere, that's not a sustainable strategy. We have to find ways how start working with those organisms, make vaccines available, if possible, even try to prevent the expansion of the disease at the source. I mean, that would be a more sustainable, for all of us. But I think we need partners. We need to work, towards that goal.
Right. Thank you very much. And we do have another 5 minutes, but there's a question that for the last 5 minutes of that panel discussion is, we're talking about trust, we are talking about gathering data and system in areas where it's hard to develop a data-driven surveillance system, where it's hard to collect or centralize information system. So what about participatory science? Should involve public in gathering data and even analyzing data, a way to not only improve the surveillance system, but also improve that trust between scientists and public, as well as public and policymakers? Orla, do you have any ideas on that?
Yeah, I definitely agree. And I think involving stakeholders and the public in setting research questions, so deciding what's of importance to them. So kind of very upstream engagement, where they help decide what should be researched, how should it be designed. And I think that does definitely improve trust in scientific process, in getting outputs from science, whether it's public or private, or a mixture of both, that have a public good. And I think we are in a movement of sort of, in lots of different domains, of a crisis of expertise, of a kind of a post-truth era, which has been budgeting for the last couple of decades. And that is a huge challenge. And I think it is really challenging for science communication. And I think, you know, so social media has a large part to play in that. I think that's an area where science communication happens in a very sort of unregulated sort of space, for according to certain algorithms, not for the public good necessarily. So I think there is a need to think about how science is done, how science is communicated, forums that we don't think of as traditional sort of science communication forums, that have become one of the main ways that science or pseudoscience is communicated. So I think, yeah, there's big, and we're seeing that very much with COVID-19 as well, kind of the misinformation and anti-vaccine movements, and so yeah, and involving people, and also kind of regulating more strongly, I think, the really sort of toxic end of science communication that spreads misinformation. So I started with your question and went in a different direction, but that's yeah, that is key as well.
I think that there are two aspects in this participatory surveillance. The aspect of involving the data sources, and the public can be a source of data, and we have different kind of public, and farmers are also data sources, and they should be involved, and the classic surveillance system should involve more and more these data sources. And you have also the general public as observer, as data collector, and this is quite new and promising. It has for sure some limits, but it can help also to detect things and to complement other data sources.
Yes, it has been developed at a research level, I would say, for example, for detection of ticks or mosquitoes, for example, detection by the public. I think it's a good way to engage the public in action. It's not only make the people understand what we are doing in terms of science and research. It's provide a way for engagement, which is very important in the future. And it's the same process probably for climate change and other big issues and biodiversity loss. If the public is involved in the process, is active, it will be much more efficient. And it's also a way to make understand what is research, what is science, and what is the collaboration between scientists and decision makers.
This could probably trigger some curiosity about the way the data that people gather together are analyzed, and give the interest in gaining more culture about the scientific and research way of thinking, probably.
This sounds very much like a game. So you want to make a game out of surveillance and for public good. That sounds good.
I think that we are actually next to the time to give back the floor to Fabrice and then Emmanuel. Perhaps if you want to have a last sentence to summarize your feeling about the things that we discussed, if one of you have something to put forward, do not hesitate.
No, just thank you.
Thanks a lot for your involvement and the really interesting things. Yeah, Teshome?
No, thank you. Just want to say thank you. Yeah.
Okay.
Thank you, and thank you for all the participants for sending questions.
Thank you very much, Xavier. Thank you very much, Thibaud. Can you hear me? Is it okay? Can you hear me? Yes?
Yes, yes, perfect.
Okay, wasn't sure. Okay, thank you very much for taking part to this roundtable and for these very, very, very interesting exchanges and talks.
talks together. Now we have a real view of the situation after all the presentations this morning and this passionate and exciting discussion together.